And in our province, we have a transgender woman named Lois Cardinal, who, after 2 years, started her transition at age 19 and received bottom surgery 2 years later. And this is her words. She says, "As I lived with shame and regret for 14 years, I came to realize it wasn't just myself to blame. It was the psychiatrists in Edmonton, the doctors in Montreal. They kept persuading me, despite my serious misgivings. I had to relearn my place as a Native and where I belonged in my culture." So she approached the government to seek medical assistance in dying because of the severe complications that she had after her bottom surgery. So these are the kinds of conversations I've been having for many years about how we can provide better post-operative and surgical care for those who are transgender. Right now, we send transgender patients to Quebec for their treatment, and then there is a gap in being able to provide transgender follow-up care. So that's one of the reasons why, as part of this policy, we'll be recruiting someone to be able to do these surgeries in Alberta, and also be able to provide a roster of doctors who can provide the lifelong post-operative surgical as well as hormonal care to transgender adults. I mean, there's no question that these young people are very troubled and need that psychological support. I have a young person in my family who's transitioning, and so I know how important it is for family to be included in those conversations, and for all the adults in their life to be supportive of them. And so I think that that is the message that we're trying to get across, that it does not do a young person any good to have a split from their families, or to feel like their families will reject them, because that's not the normal experience. People love their kids, and they're going to be supportive. We might not always agree with the decisions that they make, but we should start from a position of love and support. And if there are a tiny number of cases where somebody is at risk, then we have to have Child Protective Services step in to be able to keep that child from harm. So I would say that this is a debate that we have to have. It's a discussion we have to have. There isn't one right way to enact policy. We're mindful of what's happening in the rest of the world, in the UK, Denmark, Sweden, Norway, the Netherlands. These are places that went one particular path, and now they're trying to build a few more guidelines around some of this policy. And we think it's time for us to have that conversation here.